All right, Madison, thank you very much. A new report from the Oregon Nurses Association found PeaceHealth patients say they are not getting the care they need, especially at Springfield's RiverBend Hospital. KEZI 9 News reporter Albert James spoke with nurses represented by the union who say the issues stem from the closure of Eugene's University District emergency room last December.
The ONA survey of RiverBend patients found that many of them had negative experiences in the ER, including waiting hours for treatment. Union nurses say the hospital is getting overwhelmed by patients with limited options for care.
We are seeing increases in wait times, sometimes exceeding 6 to 8 hours, simply because the volume of people through a limited number of rooms has greatly increased.
The Oregon Nurses Association says RiverBend patients they surveyed reported long waits for emergency care, sometimes to the point where patients' conditions have worsened. Rob Sabin, a RiverBend emergency room nurse who used to work at the Eugene University District ER, says the closure of that emergency department has forced more people to RiverBend, which is dealing with a lack of resources.
With short staffing issues and bed closures throughout the hospital, along with the closure of an entire hospital, we are just seeing that our emergency room is often overwhelmed with patients, and that makes it very difficult to see everyone in a timely manner.
There are many more patients coming into the ED. Waits are longer. People feel that their care is not as good as it was, that the staff does not have the time for them, that the staff is overburdened.
Kevin Paul also worked at the University District ER and worked at the RiverBend ER. But she transferred departments after she says it got to a point where she couldn't advocate for a better emergency room.
I did not feel that management was supportive in making changes that would benefit our staff and the patient flow.
A PeaceHealth spokesperson says they've been making progress on reducing wait times at the RiverBend ER while also opening more beds at the hospital. They said healthcare has changed a lot in Lane County, and they're working locally to address the complex issue of access to care.
Back in September, the CEO of Springfield's McKenzie-Willamette Hospital said planning was in the works for an emergency department somewhere in Eugene. Coming up on KEZI 9 News 5, hear what RiverBend nurses think about that possibility. Reporting in Springfield, Albert James, KEZI 9 News.